Good afternoon and welcome to the ALS Canada webinar on Global ALS Awareness Day. We're so glad that you could join us here today. I'm Tammy Moore and I'm the CEO of the ALS Society of Canada. And thank you for taking this time. It's really important and we're really pleased that you're able to join us. Today is Global ALS Awareness Day, but it's a day that we also share with the National Indigenous Peoples Day. And as we start our webinar today, we'd like to begin with a land acknowledgement. At the ALS Society of Canada, we continue our work to learn on and address inclusivity, diversity, equity, and accessibility. We are working to understand and consider how these issues and opportunities for change reflect throughout our organization, in the work that we do to support the ALS community we serve, in the research that we invest in, and in our collaboration with the healthcare system and with partners in industry. And how, as an organization, we can demonstrate leadership to address systemic issues. While we're meeting here today virtually, I'd like to take a moment to acknowledge the importance of the land, which we all call home. As a national organization, the ALS Society of Canada has relationships and partners across the country, operating on the unceded and treaty territories of the original people of Turtle Island. Today, I'm coming to you from Toronto, where we acknowledge that the land is home to many diverse First Nations, Inuit, and Métis people. For thousands of years, it has been the traditional territory of the Haudenosaunee and Huron-Wendat. And we acknowledge that Toronto is covered by the treaty territory of the Mississaugas of the Credit. In the spirit of reconciliation, we honor and acknowledge the enduring presence of the Inuit, Métis, and First Nations peoples. And we are grateful to come together on this land. Please take a moment to consider the land that you are on and what it means to you. Again, thank you for being part of today's event. As we are here on June Global ALS Awareness Day on the 21st, it's actually June ALS Awareness Month, as so many of you know. And as an organization, it's been a very busy month, right from the lighting of different monuments across the country, to the work that we've done with our partners in the Walk to End ALS. This is such an important way that the community is able to come together and that people are able to feel that support and that spirit that together we're moving the needle. And in fact, as it is that we're coming up to our last weekend of walks here in Ontario, if you have a moment, it is a special time because we do have a match from Canadian Western Bank. So head on over to walktoendals.ca because we'd love for your donation to be doubled by that effort from Canadian Western Bank. So June ALS Awareness Month is about awareness, and we're trying to move that awareness into action. It makes a difference for the 4,000 Canadians who are actively living with ALS, the people who are coming into this community because of a diagnosis, the people who have been a part of our community because they have known someone who has been facing this disease. Today's webinar is important. We're going to hear from Dr. David Taylor, who many of you know, our Vice President of Research and Strategic Partnerships. Dave's going to talk to you about some of the most interesting and exciting things and our understanding of ALS in 2024. We're also going to hear from two of the chairs of the Canadian ALS Research Network. As many of you know, it's called CALS, and they're going to be sharing their perspectives on the evolution of the CALS network and the importance of collaboration. I know in the time that I've been here, I've seen CALS come forward in such a different way, the way that the community is working together to make sure that people across this country have access to multidisciplinary care. It's incredible to get to see CALS being able to share, to be able to collaborate, to be able to address issues that so many of them are commonly seeing. And of course, it is the 10th anniversary of the Ice Bucket Challenge. And I know throughout my social media feeds today, I've been seeing them pop up with people sharing their Ice Bucket Challenge videos. Already, I think I've probably done 4 or 5 this year, and I'm hoping that there will be many, many more to come right across the globe, as we would love to be able to celebrate the 10th anniversary, what's happened in these past 10 years, and what could possibly happen in the next 10, given the investments that we have made and that could be made if we can bring this back again. So on this note, I'm going to turn this show over to Dave and to the CALS chairs so that they can take you through what we've learned in the past 10 years. Dave?
Thanks, Tammy. As Tammy said, my name is David Taylor. I'm the Vice President of Research and Strategic Partnerships. I'm going to be your host and guide for the next hour or so. I think you may have already seen a cameo from one of our panelists a little bit later. But right now, I'm just going to share my screen and get into the first part of our presentation, which is around the state of ALS research in 2024. So I've actually been in ALS research in some capacity for about 23 years. I was at the bench working on ALS in a lab as a laboratory researcher for about 10 years, and now over 12 years at ALS Canada. And so I do feel somewhat qualified to be able to talk about where we are in 2024 versus where we were in the past. And so I'm very excited to be able to tell you about some of the good things, but I also have added in a slide just yesterday in trying to think about a different way to be able to communicate and sort of talk about the state of research in 2024. And that's a little bit of real talk and really coming from a compassionate background. And, you know, there are many sources of where you can hear about the state of ALS research in 2024. And these may go everywhere from someone saying, get your affairs in order, there's nothing we can do, which I think many of us do not agree with at all, to overselling what is known about certain drugs in a trial. You may read quotes from specific researchers or clinicians that talk about how great and amazing and promising some of these things are, and even others who are saying a cure is on its way. And, you know, one of the things that I've heard from over the many years from a lot of individuals is that they don't always get a balanced kind of view of all of it, because there's some aspects of every one of these that really kind of comes into play with sort of, you know, the reality of where we are in ALS. And then along with that, every person wants to be communicated in different ways too. So some people want just the hard truth. Some people want to have that hope. And even if it is a little bit oversold on what's there, that's what they want. And so it's very difficult to know how to interact or how to give every person, you know, kind of an understanding of what's out there in the best way possible for all of them. From an ALS Canada standpoint, over the years, the way we sort of approach this in our research team is always difficult truths with compassion and realistic hope for now and the future. We really want to be able to tell you as close as we can to what are the things that we are struggling with? Where are we struggling to try to move the needle forward, and that we're working really hard and we know it's not fast enough? And at the same time, where are the things that we are genuinely excited about where we are, so that there isn't any kind of false hope moving into the future and people can sort of get that sort of idea of where we actually are. And up in the corner, you will see just come on. We've built in this program this year currently called the ALS Research and Clinical Trials 101. It will probably be called something like that or a Q&A moving forward. Please check out our webinars and education on our website, the page on that, and our social media. We'll be updating that as we go along, but every month, and if many people come even more than a month, we'll be available for you to ask any questions, talk about something that you're interested in, and we'll just have a chat about it. In between your clinic visits, this is an opportunity to not only get some information, for us to facilitate relationships so you can get other sources of information and make up your own best informed decisions for yourself. What are some objective things? This is a worldwide effort. I actually just got back from a meeting in Europe yesterday in Sweden, where a huge part of the world came together in a group called NCALS, or the European Network to Cure ALS, really to just move the needle forward as fast as they can, and to try to collaborate and really talk about their latest research. But I think one of the key things is that ALS is not a simple disease, and everyone is trying really hard in this worldwide effort. There are thousands of people working on this every day, trying to make a better day for this disease. And I understand that that is incredibly difficult in 2024 to be diagnosed with a disease and to see how many diseases we can change the trajectory for people. We can cure diseases, we can stop things, we can do personalized treatment for people. And here we are with ALS, and we're still struggling to get medications that can ultimately stop or slow the disease progression in an effective way. And that is really one of the truths. And honestly, if there was something real out there right now that we knew could make a big difference for everyone living with ALS, we would all push for it globally. People are talking around the world with each other. If there was something on the other side of the world, we would get it, we would move it forward, and we would get it to people. And a great example of that is something I will mention later called tofersen, which is one of the first therapies we've ever had in ALS that is really largely universally accepted by clinicians around the world as something that's having a life-changing effect, slowing the disease and potentially stabilizing and even reversing parts of it for people, some people living with a particular form of ALS called SOD1 ALS. And there's a lot of complexity in that. So I'm giving you kind of a high level overview of that. But again, when something like that is available, we have the ability with global collaborations to push those things forward. One of the biggest hurdles you'll hear when you ask anyone is that we don't properly understand ALS. And that may be true, but I would put forward personally, and this is again just my opinion, that we haven't actually been able to test if we don't understand ALS very well. Most of the things we've had in clinical trials to date have not been that scientifically exciting. So we are on the cusp of getting a lot of those understandings we've had in the past several years coming into clinical trial, getting better designs to be able to test those more effectively and to find out if we actually can make a difference with this disease. And if we don't, we need to actually understand that and move forward with as much urgency as possible. And one of the other hardest messages is that ultimately we haven't made a lot of dents in terms of medication to slow or stop the disease. And there are a lot of people who will say, we need drugs in bodies now. They read a piece of media and they say, this said it would slow down disease by 40%. Why can't I just try it? And honestly, if I had ALS myself or a loved one did, and I didn't know, what is behind some of those things, I would say the same thing. But what we can say is that one of the undersold things that I'm not talking about in these exciting pieces is that care innovation has come a long way. Things like non-invasive ventilation, better management of people through multidisciplinary care, ways in which we can help with breathing and with swallowing, and all of these have actually come a very long way to advancing quality of life and survival in ALS, and they shouldn't be ignored. And really, as we get to better medications and as we work with this, we should continue to help people get around the world the best possible care. Okay. So this was a presentation that I actually gave to our Learning Institute earlier this year. It was an idea to say, we can't go through the whole state of ALS research in 20 minutes or in 15 minutes. So I'm going to rapidly go through, and believe me, this is just a little, consider this a little bit of a teaser or a sort of trailer for what you can come to our 101, and you can ask us more details about any of these things. But it's the things that me, as a person who has been in ALS for a long time, finds genuinely exciting in 2024. The first one is that awareness is growing globally, and this fits perfectly with the 10-year anniversary of the Ice Bucket Challenge. There are all kinds of famous celebrities and other individuals who have really put themselves forward and put their journey with ALS out there for everyone to see. People like Steve Gleason or Neil Danaher in Australia, Roberta Flack, rugby players in the UK like Rob Burrow and Dottie Weir. Sarah Lang's Baseball is the Best through Major League Baseball. Borje Salming, the Hall of Fame hockey player. All of these have helped us to raise not only awareness about what the disease is, but funds that have been really critical to our advancement of the disease. And actually, we know that awareness can raise funds. A great example in the Netherlands, they have great awareness across that country. And just a few months ago, actually in December, they had a 1-week radio request event that they held and raised €8 million within 7 days, something unprecedented for ALS because of that awareness building. And I think that's only turned into what number 9 is talking about, which is more funds than we've ever seen before in ALS. We now have ALS research that are collaborating on $10 million plus initiatives. Back in 2012, when I started in ALS Canada, a $5 million initiative was like, wow, I hope someday we can do more of those types of things. Those were massive. And now we have multiple initiatives around the world that would be considered $50 million plus initiatives. And these are going to allow us to answer some of the big questions we've never been able to do before, which is incredible. And when I get to the Ice Bucket Challenge part at the end, you're going to see that even $50 million is really not that much when it compares to more treatable diseases. But some of these big initiatives are going to make big differences in the next several years. And I'm happy to talk about any of those if you want to come to our 101 and bring them up individually or as a whole, and we can talk about any one of them. Coming in at number 8, while we are understanding a lot about ALS biology in the last several years, technology is also just going at such a fast rate. I remember just not that long ago, we were talking about, well, it'd be great when we can apply AI and machine learning to the biological understanding of ALS. This is not a novel thing anymore, and we know this because it's integrated into our daily lives. It's part of social media algorithms, or if I'm just near my phone and I say I need to buy some soap, suddenly I get soap ads popping up everywhere. Or even just if you order an Uber, it's all done through AI machine learning. And even things like ChatGPT are things 5 years ago we weren't really conceiving of in the same way as what we have today. And this is going to help us have the power to answer any questions eventually, because it's things beyond what our human brain can really comprehend. And in science, there's so many things we can do with technology now that we couldn't do in the past, like gene editing or brain-computer interface that will give better quality of life. Computing power is going to get better. 3D printing for better equipment and other things to help sustain people. Single cell biology that we couldn't conceive of 10 years ago, where we can look at the difference from one cell to the one right next to it. Some very incredible things. And there's all kinds of things. If you want to see something about the power of AI and machine learning, I do always like to tell people, go see the documentary AlphaGo and realize that when that computer is actually beats the Grandmaster, they built another computer that played against it for 24 hours and beat that one, which is just, to me, the most powerful example of how fast these things can learn. And if we can apply this to ALS biology, which we already are doing, we should be able to get some answers that we've never been able to conceive of. Coming in at number 7, industry is invested in ALS and hopefully here to stay. And that is the proof that our understanding has grown. When I started ALS Canada, maybe 6 to 10 companies were invested in ALS research, and now we have hundreds of companies that are invested. And this is just a partial list that you see in front of you. And every one of these companies has a particular therapeutic that they believe, based on our understanding, can have enough value to it or enough potential that they will invest money in this, hoping it will ultimately work and become something prescribed for people with ALS, so they can make a return on their investment and have a market for it. These are businesses that would not be doing this if they didn't believe we have a better understanding of ALS. And when I say hopefully here to stay, there are promising signs of these companies, even when they have negative clinical trials. Having statements like right here with Biogen's most recent negative clinical trial on something kind of exciting in the field. And they said, look, we understand that this is negative, this is disappointing, but we have a continuous commitment to figuring this out. And that's something we haven't had in the past, and really helps us to say that we are partners with pharmaceutical companies moving forward to be able to move these things across the line and get treatments to people. Coming in at number 6, clinical trials have evolved and are going to evolve way more very soon. We need to make sure that promising treatments are tested effectively. We need to make sure we get a clear negative or a clear positive as quickly as possible. And we need to do this in the most compassionate way possible, meaning that we have to minimize placebo, but also use it as much as we can to make sure we get an effective answer. And all the difficult conversations are happening, not just with the companies that are running these trials and the clinicians that are running them, but also advocacy organizations and the patient community all coming together to help do this. And there are so many things we could talk about. I don't have time to talk about any of them right now in this particular webinar. But again, if you see anything related to any of these, one of my favorite new ones, Experts ALS, I would love to talk about. Come to our 101, our Q&A, and just bring any of them up and we'll have a great chat about them. But again, I think clinical trial design is one of the greatest evolutions we've had in the past 10 years, and we're really moving forward on that in a quick way. Number 5, we are studying what some people will call sporadic ALS, slightly an outdated term soon, we think, but essentially, ALS has been divided over the years into sort of a 10%, which was called familial, where you have a specific genetic cause of the disease that's passed on from parent to child. And then there's another group of those individuals, 90% plus or so, that don't have that same sort of known genetic cause, or at least a familial connection to the disease. And what we've used to really understand ALS over the years is to take one of these known genes that can cause ALS in families and to put that genetic change into a mouse, a fish, a worm, a fly, a rat, or cells, and then to watch the disease actually progress in those animals or those cells, and look what's happening before, during, and after to try to understand what's going wrong and find treatment targets. But we've never been able to actually model what the group of people are that don't have those known genetic causes of the disease. But we have now done a lot of different things that are going to help us understand what is the specific genetic key cut that makes someone susceptible to ALS in a family. Even if they don't have a specific connection, maybe they're distantly connected to someone else, and we can look at more complex genetics. And one of the coolest things that has really evolved over the past decade or more is the ability to actually take samples from an individual living with a non-genetic form of ALS, or one where we don't know the specific gene, and actually turn those blood cells, for example, if we take a blood sample, turn those cells into motor neurons or other cell types that are actually important in ALS, and study that person's cells, human cells, in the laboratory to understand what's going wrong and try to find ways to treat it. Coming in at number 4, we are getting closer to a world of ALS personalized medicine. And that comes back to what I just said, where we can actually study personalized human cells, and it's becoming much more commonplace. For example, in 2005, this was almost inconceivable. It was too expensive and way too hard 10 years ago. There were a few people working on this in 2019, and now in 2024, the majority of studies we see are actually using these types of personalized cells. And beyond that, we have big initiatives. I've told you about the big money and the big awareness we have. We're finally getting big initiatives that are allowing us to understand why one person is different from the other. And there's all kinds of things we can talk about here, but as we learn why one person is different from the other, and we can do discovery in human cells in the lab, we can actually start to put those things that we discover into clinical trials more effectively, and ultimately, we hope, get to treatments that will have a much better effect than the ones we've studied to date. So hopefully we can get to that world of ALS personalized medicine in a way that we think of cancers, for example, where someone is diagnosed with a specific form of cancer, they're given a specific treatment regimen ready for them and tweaked as it goes along by measuring specific biomarkers to say, this is how the disease treatment is going, and we're going to up this one or lower this one. At the same time, when we think about the potential that ALS may be different from person to person, we still shouldn't give up on the fact that there's a potential for a unifying treatment that might be able to help lots of people. And one of the targets that we've thought about for many years and we've known about since about the mid-2000s is called TDP-43. And I won't go into too much detail of this right now, but essentially in ALS, this is a particular protein that is found in this sort of command center called the nucleus. It has a lot of important functions there. In ALS, we know that it actually leaves that area of the nucleus, and it can actually clump up in the areas outside of it called the cytoplasm. And we know that some people believe that it could be that the loss of its normal function here in the nucleus might be what's toxic to motor neurons. It might be the gain of its extra function by these clumps outside of the nucleus that is toxic to it, or it might be a combination of both, or it might not actually be a major trigger of ALS, but we need to study this. And we're finally in 2024, I think, on the cusp of doing that in an effective way in clinical trials. In terms of that loss of nuclear function, we actually have clinical trials happening right now. Two of the probably most scientifically exciting ones, Stathman-2 and UNC13A, are on their way or in trial right now. And we have other ones that are coming closer to studying in clinical trial the gain of function of TDP-43. The hope is that this could be something that might be effective for a larger number of people. But until we study that, we simply don't know, and we're getting closer to being able to answer those questions. Coming in at number 2, we are looking closely at asymptomatic ALS for the first time. And why is this important? Because this is the idea that we may actually be able to treat the disease before the symptoms begin, the underlying biological disease, and maybe have a much stronger effect on treating people. In fact, could we someday prevent ALS or even stop the disease in a state well before those symptoms begin, or even a very light level of symptoms over a longer period of time? And we have actually got, for the first time ever in 2024, a clinical trial happening that is treating people at the time of the underlying disease biology happening, in a time period that we believe is about a year before the symptoms begin. And this comes through tremendous volunteers who have known genetic causes of the disease being involved in research around the world that's now happening around the world, where we can study them and monitor them over time to look for those underlying biological symptoms that are happening so that we can understand how we might be able to detect and treat the disease earlier. And this leads us into number one, which I think is the most exciting thing at this current time, and that is that we finally do know that ALS is a treatable disease. And this comes largely from, as I said before, a drug called tofersen, which treats a subset of people, about 2% of the disease, that have a specific variant in a gene called SOD1 or SOD1. And there's also a group that is a small percentage as well, and that have a genetic variant in something called FUS that we don't have the results on yet, but we do have some interesting observations that have come forward that help us to believe this might be having an effect. But what this is telling us is if we hit the right target, we hit it effectively at the right time, we can actually make a difference in this disease. And I don't have time to talk about it, but if you want to talk about tofersen, which is also known as Qalsody, approved in the United States and in Europe now, it's applied to Health Canada. We'd love to be able to talk about that in more detail. Also to talk about what it means to treat upstream targets of the disease and what this can mean versus many of the different targets we've been treating to date. And FUS, as I said, we've seen some very intriguing things like people who have actually rebound with very aggressive forms of the disease and trying to better, hopefully, when we get the results, we'll find out whether or not the FUS is as we hope it will be. But now we believe the ALS is actually a treatable disease. And if we can do that earlier, we may even have a more substantial effect. So I don't have time to go through all these in a recap again, but happy if you want to take a screenshot of what I believe are the top 10 exciting things. Again, we want to find those right targets for everyone. We want to hit them with the right treatment at the right time. And we want to do everything in a scientific way to get answers from every clinical trial we do so that we can move the field forward with urgency. And there are other things that are going on. We still need to do a lot of work on trying to understand how cognition and behavioral changes affect ALS in a very real relationship with frontotemporal dementia. We need to do more work on environmental factors to understand things. And we absolutely need to do better to make a globalized world for ALS, not just in research, but access to treatments when they do become available, to make sure we're lifting everyone up here on Global Awareness Day. It's important to mention that. But we can trust the past about the future. What does that even mean? If we look back to 2012 when I started ALS Canada, these were the movies that were big at that time. This is what I look like. And I will tell you, if that guy watched this webinar today, his mind would be blown because he would be able to see so many things that couldn't have conceived of back in 2012. So let's look at the future like this guy, because I think in the next few years, again, we will continue to exponentially move things forward. We still have a ways to go. It's still incredibly complex. It's never going to be fast enough, but we are working worldwide to try to fix this as fast as possible. Okay, so don't have time for questions because we're going to move into our awesome panel right now, but just want to say research@als.ca. If you have any questions, please do keep an eye on our webinars and education for our drop-in Q&A 101 program, which we're having monthly, and come and ask about any of these. We'd love to chat about it. But I'm going to switch gears now. I'm going to stop sharing my screen, and we're going to let in our two esteemed panelists to have a quick chat here. So we are joined by two of the three members of the executive of the Canadian ALS Research Network. I see Dr. Schellenberg on there right now. Dr. Kerri Schellenberg is a neuromuscular neurologist and associate professor at University of Saskatchewan. She is the medical director of the ALS Clinic in Saskatoon, and many more accolades. Currently the chair of CALS. So we are very pleased to have you here, Dr. Schellenberg. I'm not sure, is Dr. Breiner here with us, or? I did see him pop on earlier. There we go. Hi. We're also joined by the Ari Center for Neuromuscular Disease Chair in ALS Clinical Research out of Ottawa, and leading the charge for medical care and research in Ottawa, Dr. Ari Breiner. Welcome to both of you. Thanks for joining us.
Thanks so much. Dave, I loved your talk. That was so fantastic and gave us such a wonderful overview of what's happening, not only here, but worldwide. So that was wonderful. So glad I had an opportunity to hear.
Well, thank you. I didn't set that up, by the way, anyone.
Thanks for having me as well. Nice to be here on Global Awareness Day and to be able to contribute and be part of the the effort to raise global awareness. Great to be a part of it.
Thank you, Dr. Breiner. So the Canadian ALS Research Network. This is a network that has been, let's just say, built on a foundation of great Canadian excellence in clinical trials that existed for many years. And in 2008, it became formalized to really bring clinical trials to Canada, to promote and assist physician-led clinical research and academic initiatives, and to develop tools and resources to share with the ALS community. This allows you to have a unified, I'm going to read some of these things. It provides a unified national voice. It supports physician-led studies together. It's a central hub for 23 centers of excellence in this country, and allows you to address matters collectively and quickly. So, thinking of CALS, I actually thought it would be great to hear from both of you a little bit about what your thoughts are on CALS, and then how in your own specific areas in Ottawa and Saskatoon, CALS has been able to help you move things forward in your regions, particularly as if we look back even 10 years, both areas did not have what it has today. So I'll start with Dr. Schellenberg, and then perhaps Dr. Breiner can chime in.
Sure. Yeah, I agree with everything you have said about CALS. It is a multifaceted group of objectives that we're filling. I think the thing that really hits home for CALS is the community. And we do have such a wonderful group of physicians and researchers across Canada. I learn from them daily, and I'm so privileged to be in this role as chair of CALS. For me, I'll just give you a personal example about how meaningful CALS has been to me in my career. So when I first came to Saskatchewan, 7 years ago now, there was no multidisciplinary clinic. And we advocated very strongly for multidisciplinary care here. And one of the things that was instrumental in building the clinic was using the best practice recommendations for managing ALS in Canada. And this was a document that we as ALS physicians across Canada put together with the support of ALS Canada. And it clearly shows that multidisciplinary care is important and is necessary in centers across Canada. And so I was able to present this document and present the work to the people in charge in my institution and in my health region. And it became very obvious and very clear that we needed a multidisciplinary clinic here. And through the advocacy and through the support of CALS and ALS Canada, we were able to form this clinic, which not only is multidisciplinary, but now is also able to provide research opportunities, both clinical trials worldwide, as well as national collaborations and studies that are done locally within our group of collaborators. So I think that's really important. And in this talk, I agree with David that we don't want to just focus on medications, because the actual role of the multidisciplinary team is so important. And I'd like to get into that later, Dave, but
Absolutely.
or maybe now.
Well, why don't we hear from Dr. Breiner about that?
Perfect.
And we can definitely come back absolutely to that topic.
Sure. So thank you. Thanks so much for the opportunity to speak. I guess I wanted to, when I heard about the webinar and sharing our experience about CALS, there were 4 or 5 points that really came to the top of my mind as to why CALS is such an important contribution to the ALS community in Canada. And I think part of understanding how important it is understanding how CALS has evolved. So it was initially really started by Lauren Zinman and a small group of clinical trials experts like Dr. Zinman, Dr. Genge in Montreal, Dr. Johnson in Edmonton, and a few others who were at that time the only ones really involved in performing clinical research trials, and it was established with that very limited mandate to actually just take over and centralize the clinical trials in Canada. And that was important around 2008 when it was established, because we were seeing reports of things like lithium coming out in the literature, where this was looking very exciting in animal models, but needed to be tested in humans, in people with ALS. And Canada was able to really take a leading role, I think, partly because of this CALS network that had just recently been established. CALS has changed since then, and it's evolved, and I think its evolution is really its strength. And the reason I say that is because since 2008, there have been many more sites involved than just these large population centers where patients already had access to a multidisciplinary clinic. And by involving smaller centers, what we've done is really engage physicians at smaller hospitals and smaller cities in excellence of care, really high quality care, adhering to best practice guidelines, to make sure that everyone across the country has equitable access to ALS care. And I think that decentralization and the involvement of many sites is actually a really positive development in the evolution of CALS over the last 15 to 20 years. So there's been this evolution and this decentralization. And if you just look at our panelists today, well, it's Dr. Breiner from Ottawa, Dr. Schellenberg from Saskatchewan, not Toronto and Montreal, that are actually joining us today on the webinar and leading kind of the efforts to unify the clinics in Canada. And I think that the involvement of us at smaller centers is really a testament to our success. That's the first thing that comes to mind. Dr. Schellenberg already alluded to my second point, which is that as centers, we support one another when we're setting up research infrastructure. So when I moved to Ottawa in 2017 and wanted to set up a research infrastructure here, sure, I can post and hire a research team, but who's going to train them? And we really relied on our colleagues and the excellent collaboration that we have through CALS to make that happen. So I, of course, leaned on my colleagues at McGill, Dr. Genge and her excellent team, and they were really helpful to get us up to speed in terms of what it means to run an ALS clinical research center. There was already a multidisciplinary clinic in place, so that, we didn't have that struggle that Dr. Schellenberg had, but the struggle that we faced was going from a site where there were no multi-center studies happening, there were no locally driven studies happening, and setting up that whole infrastructure with everything from centrifuges and fridges and how to recruit and dealing with research ethics boards and contacting study sponsors and getting our own studies off the ground and applying for grants and many of the other steps that we don't even think of was all made possible because of this central network in CALS and other colleagues that I could lean on. I think as a third point, CALS is also super helpful to keep all the centers, I would say, on the same level or up to date to the same degree. And that's really a testament to the huge effort put in by ALS Canada in making sure that the centers are in contact with one another. And that might be through just a series of emails that are sent out by some of the staff at ALS Canada, who do an excellent job at summarizing developments. There are quarterly meetings that we have as a group, which are facilitated. And then, of course, we meet annually in Toronto for an amazing clinical and research forum every year in the spring, which allows clinicians to address questions with colleagues, to hear about research updates, and to just get cutting edge information from within the field. And then one thing if I'm talking too long, please interrupt me, David, but just maybe I'll make one more point and then I'll let someone else speak. But I think one really important thing about CALS, and one thing that really comes first to mind, is that having this network helps us to kind of highlight and encourage successes that are made in Canada. And I think it's really important that Canadian scientists, investigators, physicians and patients have our own voice, and that we're able to actually be heard for things that we think are important in ALS, both in terms of clinical care and as well in terms of clinical research studies. And I would use some recent examples of the probiotic study and the pimazide study, and the upcoming darifenacin study, even as examples of really made in Canada ideas and successes that can be nurtured because this network actually exists. So sorry for being so long-winded, but I had a lot to say.
You're passionate. That's a good thing. The passion comes across. And actually, thanks for shouting out as well my amazing colleague, Colleen Doyle, who is the Senior Manager of Research and CALS at ALS Canada, who has also been a big piece of supporting where CALS is at today. And I know Kerri, Dr. Schellenberg shaking her head on that. Yeah, so actually I want to come back to that, Dr. Schellenberg. You were going to talk about care, and actually it's a nice segue because we're also talking after this a little bit about the Ice Bucket Challenge. One of the things that was able to expedite was the best practice recommendations. And, you know, you were part of that working group. It took a while, but I mean, it really highlighted the importance of advancements in care, and I think you were kind of alluding to that before you were going to speak about that. But also maybe you could also talk about how that was a great example of bringing sort of modern CALS together in terms of the types of collaborative work that you could do. So I was wondering if maybe you could comment on that, and as you were going to say about advancements in care research.
Yeah, absolutely. So the Ice Bucket Challenge funded the best practice recommendations, and that was, as Dave alluded to, that was really a time where we were able to bring CALS physicians together on this important project. And Canada is small, you know, comparatively. And we as ALS physicians do know each other quite well. But this particular initiative really brought us together and helped us to align all of our views on the various management strategies in ALS in a very real way. So this, in developing the best practice recommendations, we had a series of meetings by phone as well as in person. And it was really a venue where we were able to discuss all of these various aspects of care and make sure we were on the same page. And we were able to have wonderful conversations, even when we maybe didn't necessarily agree in all the nuances. We were able to have really helpful conversations. And, you know, as a physician practicing in one's own small area and in one's own small province, sometimes you wonder, you know, I learned this and I do this, but is this in line with what other people are doing? Am I providing care that is comparable to what other centers are providing? And I think these guidelines really helped us to become aware that yes, we are, and helped to align that best practice across Canada. And I think in doing that, what really came out is the importance of multidisciplinary care. And we have a lot of conversation about medications, but we don't often have conversations about how being in a multidisciplinary clinic can improve quality of life and quantity of life. So they have done, so there have been studies worldwide in various countries that show that simply attending a multidisciplinary clinic can provide 7.5 to 10 months of additional survival compared to those who don't. That's huge. And why? Well, I think it's a combination of not only having access to different life-saving measures or life-prolonging measures, but often the power of joint decision-making. So you get the right piece of equipment at the right time. And so, and using the expertise of a multidisciplinary team. And what I mean by that are speech language pathologists and dietitians and nurses and physios and OT and respiratory therapists and physicians, respirologists. It's bringing the whole team together. And so we know that certain studies have demonstrated that using a feeding tube for nutritional benefit can provide another 4 months of survival and quality of life. And then BiPAP, so a breathing machine to help support breathing in a non-invasive way, has been shown to increase it even up to 1 year. So that's huge. And when we think about that, we need to be pushing for new medications and new therapies and new research, but we also need to be pushing for access to multidisciplinary care. And so we, as CALS physicians, are the physicians who direct these multidisciplinary clinics across Canada. So we're very passionate not only about research, but also about multidisciplinary care.
Great. Yeah. And actually, I think all of this has led to, I'm thinking about the people who are listening in Halifax or in Newfoundland, or in areas where they, don't necessarily have access to research right now, or maybe less of a multidisciplinary care clinic. And, what you both said kind of helps to show again that CALS is constantly thinking about these areas in Canada where they can be the next Ottawa or Saskatoon. And we know that BC has now got someone who's in place who's going to help with that. And we're, as a network, you're trying to help Winnipeg and you're trying to help others. And that's sort of the collaborative piece of it all. So actually, Dr. Breiner, I wanted to ask you, I think this year was the first time you were at one of the newer sort of in-person meetings we have for CALS, the annual meetings where everyone's together and they're talking about who's doing what with genetic testing, who's doing what with genetic counseling. Here's a particular treatment. Here's the results. What do we all think about it? Could you tell me a little bit about what it was like to sort of be in that room and be able to share your thoughts with everybody and how that helped you, to sort of think about things that maybe, you weren't able to bounce off every day, your colleagues?
Sure. So thanks. I think it was a great opportunity, and I'll explain why. Although ALS is a very important disease, it's still a very rare disease. So in each of our centers, many of us who care for patients with ALS are a little bit in a silo, in that we generally would take most of the responsibility for making treatment decisions, making diagnostic decisions, deciding whether or not to pursue genetic testing, deciding at what point we're going to try to apply for exceptional access to particular medications, et cetera, et cetera. Attending the national meeting allows us as clinicians not to feel that we're in a silo any longer, and to feel that open debate and discussion are encouraged. And actually the agenda for our meeting kind of encouraged that and allowed time for really frank discussions. And I will admit that there were disagreements on various topics in the room. Things were handled respectfully, but at the same time, there are different point of views on how to manage particular symptoms, on how to approach things like genetic testing, and on how hard we should or shouldn't be advocating for specific treatments. And just like we share successes, we also share failures. So obviously, we all in the larger community deal with the repercussions of Albrioza and the very disappointing results from the phase 3 clinical trial. And having colleagues to bounce ideas off of as to how to deal with things like that is also very helpful, in addition to discussing, debating, advising each other about management decisions on a day-to-day basis. So really what I would say, just to come back to my original point, is that it takes you from feeling like you're isolated or one person in a silo making a decision, to feeling that you have a bigger community that may have a different experience, a different knowledge, and that are able to discuss and debate in a informed and respectful way.
Great. Thank you for that. And actually, I will also throw out there that if people have questions at any point in time, we won't be answering them necessarily live, but we will always get you those answers. And we can also, if you have questions for Dr. Schellenberg or Dr. Breiner, we can certainly pass those on and get some of those questions for you as well, for those who are out there. I did. We are actually already down into the last 5 minutes, but one of the things that I know is really important to so many people is the idea of having access to clinical trials and some of the most interesting targets that are out there. A big shout out to Dr. Breiner, you mentioned earlier, Dr. Genge. She's a global force who has brought so many different clinical trials to Canada. But Dr. Schellenberg, you know, having now been in that space as well for quite a while, what's the difference between, for example, when you were starting out in terms of the clinical trials that you were seeing coming across your desk or coming across Cal's desk to consider having versus now, where it seems like there's always things that are coming along to be considered?
Yeah, you hit the nail on the head. It's just the sheer volume of trials that are happening now. So I remember when I was a student, everybody would jump on an opportunity, regardless of what it was, for clinical trials because they were so rare. You'd get an opportunity, every few years. And now I get an opportunity, multiple opportunities every month comes by my desk. And it's, it's just amazing. And I think it's a testament to the interest and to the explosion of research that's going on for ALS across Canada, across the world. It's a very exciting time. And I think it's a time that provides a lot of hope because we have so many exciting targets and exciting opportunities. Yeah, it's completely different, Dave. And I can really relate to that one meme you showed with the exploding head, because I think I'm in the same position where when I was a student, it seemed like effective treatments, very effective treatments, multiple treatments were out of sight. And now we have so many exciting opportunities.
Dr. Brian, I want to comment at all? I will say one of the cool things about Canada right now is we're actually become a site for phase 1 clinical trials of some very novel things. And, quite often we look at the United States and say, well, we don't have what they have because they have, 80 trials. But we have more now here in Canada than most countries do have. And I know, Dr. Breiner, you've, in recent years been coming into trials and also, as you admitted before, even working on one that's academically driven that came from Canadian research and can go straight into, through those relationships with Cal, straight into the clinic. So thought you might maybe comment a little bit on the trial side.
Yeah, for sure. I think my view, I mean, I've been in ALS trials since 2018, so it's been about 6 years. My view is that in the last 6 years, I've seen Canada become a country which is really desirable for companies that have a novel molecule that is showing promise in ALS. And I think the reason that Canada is a desirable site is because we have this idea that we have to be essentially clinical trial ready, and that centers are preparing themselves to be able on short notice to test trials. It might sound easy, but there is a lot of regulatory and ethical work that needs to be done behind the scenes in order to do that. The centers have to have the facilities and equipment that are ready to conduct these clinical trials. And so there's a large effort that goes into becoming quote unquote clinical trial ready. And my sense is over the last 6 years that companies are deliberately seeking out Canada. And I think it is a testament both to those that sort of were pioneers in CALS, but it's also a testament to how nicely CALS has grown to incorporate centers that weren't doing trials before and that can recruit patients and maybe were kind of untapped potential for ALS trials. And I would consider our Ottawa site as one of those kind of untapped potential sites. On the side of investigator-initiated studies, I think there is something nice about doing trials which have roots both in Canada, but also at the university bench level. You know, we have excellent partnerships with industry, and I value those very highly. But I think there's something nice about an interaction with our basic scientists at the university level that allows us to translate their bench discoveries into the clinic. And I'm very excited for the upcoming dairy venison study that we're hoping to launch in the next short while.
Thank you. Yeah, Ice Bucket Challenge funded parts of that, everyone. So we're going to get into that in just a moment. So we've actually burnt through most of the half hour already, but I wanted to give you both just a chance before we sign you both off right now to just say, you know, in thinking about where Canada stands and where the field stands, you know, what is it that you're sort of most excited about in 2024? So I'll start with Dr. Schellenberg, go to Dr. Breiner.
Yeah, so with respect to the clinical trials, the thing I'm most excited about is very similar to what Dr. Breiner just mentioned. His site is going to be involved in the dairy venison, and we're poised to become part of the probiotic study led by Dr. Matt and Dr. Parker, which is also a Canadian-led study, bench to research. And I think the fact that you have two people on this talk, both of whom will be involved in that very Canadian-based bench research, basic science bench to clinical trials, is just highlights the strength of CALS and the strength of research here in Canada at this time, when we have the resources and the connections to be able to do so.
Thank you. And Dr. Breiner?
I guess a few things. I'm excited about the more targeted therapies that you kind of alluded to in your presentation. Some of the therapies that are targeting the TDP-43 pathway do seem quite promising. I'm excited about the pre-symptomatic study of in SOD1 ALS, and I think there'll be some really interesting data coming out of that. And then I think we also have to highlight that the international ALS meeting will be coming at the end of the year, will be coming to Canada. And so I think that'll be a chance for us not just to convene nationally, but to convene internationally here in Canada. And I think that'll be a really nice opportunity to hear of all the cutting edge work that's been done.
It's a great shout. Thank you very much. Well, thank you so much, both of you, for your time today. We really appreciate having you on. And as I said, if there are questions that come in, we may forward some of those on. But just a tremendous pleasure to have you here on Global Awareness Day, and wishing you both a great rest of your Global Awareness Day.
Thank you so much for having us, and also a huge thank you to ALS Canada. We could not possibly do what we do in CALS without the support of ALS Canada, and specifically Colleen and Carolina and David. So again, thank you so much. ALS Canada makes us run as CALS.
Thank you. And actually, shout out to the other co-chair, the past chair, Dr. Kristen Shoesmith, who couldn't be with us today, but has also been a tremendous force for CALS over the past couple of years from London, Ontario. Perfect. So I'm going to now share my screen for the last portion of the webinar, which is going to be back around the Ice Bucket Challenge. And that is not the right presentation, but I will get over to the right presentation here. And this is going to be a really quick overview, but I think 10 years later, we feel it's really important to be able to just give some people at least a high-level view of how tremendously impactful this is, because it's not always so easy to really have that kind of visual as to how impactful it is. And I know that some places like the ALS Association will have a report coming out. And so this will be a little more of a less formal way of really describing it. Okay, so first of all, what is the Ice Bucket Challenge? I think most people know what this is, but not everyone may necessarily know what it is. So I just give you a very quick background. Really early in 2014, there were kids in the southern United States who started challenging each other to jump into water. And the first person that didn't really have a pool was this woman, Holly Hatfield, and she ended up using a bucket. And then one of the friends she challenged here, Sarah Spivey, used ice in the bucket. And that became people dumping ice buckets or water with ice in it over their heads. But by the late spring of 2014, people started to monetize this for various charities. So they said you either pour ice water over your head or you donate to your favorite charity. One of those was actually called Alex's Lemonade Stand. So it was actually the Ice Bucket Challenge for ALS at that time in late spring of 2014. One of the major avenues that gained prominence was through motocross riders who were quite famous in their discipline and who happened to have connections to members of the PGA. And that actually spread all the way through to the Today Show and to celebrities like Martha Stewart, who ended up actually challenging Gwyneth Paltrow, Blake Lively, and Ellen DeGeneres, who none of them actually did it at that time. And it kind of ended with one of the big lines of ALS Ice Bucket challenges where people challenged each other at that particular time. However, also in June 2014, sort of a parallel avenue that was happening, a young woman who died while in a hiking accident, JC Bertuzzi in California, happened to be in the same town as a hot sauce company called Carmelina's Hot Sauce. And we believe it's potential that there was, ice bucket challenges happening. They ended up doing it. This gentleman, Daniel Valencia, did it. And he actually challenged some golfing friends who ended up challenging long drive championship friends who went to more amateur golfers and ended up going to this gentleman, Chris Kennedy. And I won't play the video for time here, but basically Chris Kennedy was the first person to say that his charity of choice was ALS, and he connected it to his cousin, Jeanette Sinertia, who is married to Anthony Sinertia, a gentleman living with ALS in Pelham, New York. Now, Anthony Sinertia had an overlapping network with a gentleman named Pat Quinn in Yonkers, New York, who had a group called Quinn for the Win. They started doing Ice Bucket Challenge in the name of ALS. Both groups were doing it in those areas. And Pat had an overlapping network with someone named Pete Frates in Boston. And so with 3 groups of families doing this and pushing this and driving this towards ALS, it was starting to get sort of branded as an ALS charity fundraiser. Now, Boston and New York areas were doing it all over social media, and one of the friends of Pete Frates, who happened to also be friends of the gentleman Greg Campbell, who played for the Boston Bruins, they convinced him to do this in his Muskoka home in I believe either late July or early August of 2014. He challenged more Boston Bruins, and then it started to go through the sports world. It went to larger media, to the Tonight Show, to Justin Timberlake doing it on the Tonight Show, the New England Patriots. It went to hockey world, as I said, through the Bruins. This came to Canada, and it really went viral from there. So how much was raised? Globally, about $220 million originally for ALS. I say originally because we know that actually investments were made while the funds were being put out that actually allowed for more funds to be raised over time from those original funds. And the USA raised the majority of those funds, $115 million of that to the ALS Association. They've now just said this morning that they were actually able to fund up to 150 million now because of the investments that were made and the way that this was strategically put out in a very smart way. And Canada was able to raise $17.2 million nationally. All of the groups in Canada that raised those funds came together and committed $11.5 million of that to research, of which $10 million we were able to match through the ALS Canada Research Program to bring Canada to a $20 million program. But the funds keep getting raised, and a lot of things that are being leveraged today are coming still from awareness built through the Ice Bucket Challenge. A great example, Fight MND actually used this concept to build something called the Big Freeze, which they do every year and is raising tens of millions of dollars a year, up to I think $80 to $100 million in the past 10 years. A little bit of perspective very quickly, people expected a cure. This is a very complex disease, and at the end of the day, it's still far less money than most treatable diseases get annually. And this is seen very well if you look at the movie called You People, which is a Netflix original movie. At the very start of the movie, Jonah Hill says that ALS is the most paid disease of all time. We're on the boat with Beyonce and Jay-Z, and that's simply not the case. And in fact, if you look at annual global cancer funding, we're talking about $8.5 billion a year to allow us to have the treatments of where we are today. And that extends way back before 2014 that there were billions of dollars invested. But just for some perspective, 38 Ice Bucket challenges per year would be needed to match that. So if we look at one cancer society, American Cancer Society, they give about $175 million a year in discovery research funding. The compensation in that organization is more than Ice Bucket Challenge funding. And then we were to say, let's pretend we're going in front of a board of directors for an organization that gives $175 million a year. And they say, what have you been doing over the past 1.5 years? It's incredible. The number of things that have come out of the Ice Bucket Challenge are far too numerous for us to talk about in this particular webinar. And I would be happy for anyone to join us again on our 101 to be able to talk about any of these things. And we could elaborate on some of the great things that have come out of the Ice Bucket Challenge. But just our genetic discovery, we are poised now to do a more complicated learning of what genetics means to everyone's ALS and to figure out how to approach that better because of Ice Bucket Challenge funding. Big personalized medicine initiatives to understand why one person is different from the other. All kinds of fundamental research to understand the disease, and treatments that are now in clinical trials, some of the exciting ones we've already talked about today, and ones that are forthcoming. Trial design, I told you, is important. We've made all kinds of advancements because of Ice Bucket Challenge funds. We've got new people working in the field, both clinically and in the lab because of Ice Bucket Challenge funds. Environmental risk factor work, better ways of care, brain-computer interface, new technologies, education, ways in which we support infrastructure around the world, all kinds of these things. And if we think about now, all of those funds have also leveraged big funds we're getting in other places because they set up the ecosphere to be able to go and get big funds from places like the UK and the US government. And a lot of the things I just told you about in the top 10 things would never have been where they are today if it wasn't for the Ice Bucket Challenge. So if we were to stand in front of that board of directors, I think they would say, boy, it has been a very good year with the funds that we've invested. And honestly, again, if you want more detail on any of these, we're happy to talk about that. It's also important here at ALS Canada to make sure we talk about some of the highlights from the Canadian research funding that happened. You may have heard of Capture ALS. This is our contribution in Canada to the global effort on understanding why one person is different, looking towards that personalized medicine type aspect. And we funded the largest grant we've ever given in collaboration with Brain Canada to a network that built Capture ALS. As was alluded to earlier, the best practice recommendations, young researchers that we see down below who have started labs that are permanently contributing to ALS here in Canada, and also one Canadian working in the United States in a prominent role. You heard about the darafenicin trial, which was just alluded to by Dr. Breiner. Early work from that was actually supported through Ice Bucket Challenge funds. And we're actually going to hear about that if you want to come to our clinical trials unboxed session on July 4th with Dr. Richard Robitaille. New targets developed here in Canada that are exciting, our contribution to the global genetics efforts, new targets that are really exciting in scientifically coming into clinical trial, where early studies that alluded to that came out of Ice Bucket Challenge funding right here in Canada, and so much more. Again, we don't have time to talk about those in much detail, but I wanted to at least highlight those for you to say, if you want more detail on any of this, we are happy to provide it. But one of the things I think it comes down to is, how can we say this in a very simple message? So if someone says to me, you've got a very quick 1-minute pitch on why the Ice Bucket Challenge had impact, this is how I would do it. 2014 Ice Bucket Challenge happened. You saw Tammy before. This is her having like 20 buckets dumped on her head. This is where we are today in 2024 in terms of our understanding of the science. So let's just say this is an arbitrary place. We are getting closer to a point where we have multiple solid treatments for people living with this disease. We don't know how far away it is, but we are getting close. You heard today, we are excited about getting there, but we still have some more work to do, and that's the honest truth. And a little bit further than that, we get to where our vision is of a world free of ALS. And there is a time frame ahead of us in which we will get to those times, and we will work with urgency and the global effort to make that happen. If the Ice Bucket Challenge had gone viral for something else, we would have been not nearly as far as we are today in the science. And we'd be much, much further from multiple solid treatments and a world free of ALS. And that would only be compounded by the things that we've learned and grown exponentially from what has been foundationally built by the Ice Bucket Challenge. A simple way of thinking about that is the science we're doing today, the science I heard about at that meeting I was at just this last week in Sweden, wouldn't be happening for several years if we didn't have the Ice Bucket Challenge. And I think probably for me, the biggest impact of all of this is that there will be people in the future who would have been diagnosed with ALS who will not be diagnosed with ALS in the future once we have that world free of ALS. And for those people, that makes a massive difference. We will have treatments that are effective. We will get there, and we will do it as fast as we can. was still a very complex disease. And if anyone has more questions on that, again, I'll plug one more time, research@als.ca, and please come to our 101 and have a chat. And we're happy to point you to other people, get as much sources of information, and make your own informed decisions on how you feel about where we are. But I absolutely believe that the Ice Bucket Challenge has had massive impact. In terms of a quick question and answer, I'm just going to take 1 or 2 minutes here. We did have a number of questions that came in ahead of time. We're going to source where those questions came from, and we're going to answer those individually. Again, if you come back to our 101, we can talk about any of them in particular. Someone asked about current trials. There are all kinds of them. If I were to just off the top of my head say what one is probably scientifically at this moment most exciting, I would say look into UNC13A. But I will also say we don't know yet. But that is one that you could look at. It's not in clinical trial yet, but in fact, there are probably from a scientific standpoint, probably the one that is most exciting. Maybe Stathman too as well. Why do we not have government financial support? That's a tough question. But what I will say is in Canada, if we want research support from the government, which we do get through Matched Brain Canada funding through the federal government, but if we want direct support, we need to come together as a community in all ways towards a specific ask. That has been really helpful in the UK and the US to getting the unified efforts that have resulted in things like the UK Research Institute. There are many other questions. I will say one last question and we'll pass back to Tammy. We got a number of questions around the discovery at Western University by Dr. Michael Strong. You can read any of the things online about that. This is an example of many of the cool things that are happening in the field that we're driving forward and are hoping to get to clinical trials someday. We've seen lots of times where animal models like the ones in that study in flies and in mice where there's been something promising. Not all of them do reach clinical trial, but we're hopeful that they will quickly, and we are hopeful that we'll be able to find out if they have any effect. So if there are specific questions on that one, please do feel free to drop by and ask us any of those questions. But it's just a testament to how many things around the world are at that stage that could potentially be treatments in the future. We don't know yet, but we will keep driving forward with urgency. And I'm going to leave it at that because my time is up, and I'm going to pass off to our fearless leader at ALS Canada, Tammy Moore. And thank you everyone for your time, and we will see you at our Q&A 101 next month, the month after, whenever you have questions.
Thank you very much, David. And thank you to Dr. Breiner and to Dr. Schellenberg for being here with us today. And, you know, as somebody on a personal note whose family was impacted by ALS, and that's what initially brought me to this cause and to this field, I found so much hope in what your messages were today. And I think so often we hear that it's about the treatment, it's about that specific. And what I really appreciated was there's so much more to it. It is about the multidisciplinary care that is provided across the country. It's a way that there is a continued building of the supports that are there. The best practice recommendations, Dr. Schellenberg talked about how she utilized those in Saskatchewan, and I can tell you about how we're utilizing those in Ontario to be able to bring forward an ask to the provincial government to be able to support the clinics in Ontario, as well as the services that ALS Canada is providing directly within our province, either it's the equipment program or the community services, so that people have the resources that they need. And we're using that as an opportunity to have that leveraged in each of the other provinces to be able to take that framework to go to their provincial governments to say, you know what, the ALS community deserves more, and here is a framework to be able to provide those supports. In Ontario, it's less than $5,000 per person annually if the government was to provide that. It's not a big ask, but it's a critical ask to be able to make a difference. So in the stories that we heard today and the information, I hope that it has provided you hope on Global ALS Awareness Day. And again, a recognition that your experience with ALS is very specific to you, but that you are provided some hope and understanding that there is a global community that's working collectively together to advance the field in so many ways. Associations working collectively to be able to share information and resources ALS Canada is out there. We've been sharing our community services with people in Scotland and within the US to be able to help them better. And we take back and learn from them as well. It's the work that David's doing to be able to be there on the international stage and making sure that Canadian work is showcased, whether it's clinical or whether it's research. And again, there are resources brought back to Canada. We are so excited to be able to co-host with ALS Quebec, Montreal 2024. It's a series of 3 meetings: the International Alliance of ALS M&D Associations, the Allied Health Professionals Forum, and then the International Symposium, which is research and clinical work where people are going to be sharing. And I can only tell you that there are just a million meetings around those meetings that, again, make sure that there's that exchange. So please know that you are not alone in your journey with ALS, that collectively we are here for you and we are helping to make a difference. If you require more information, Dave's mentioned research@als.ca. Visit our website. It's a wealth of information, and we're going to be very excited as we launch our new website later this year at als.ca, where you're able to get what you require, and it's a trusted resource that you can go to. And of course, there's still time with the walk to end als.ca. We've got that match going out, and the funds are really critical to be able to help and provide funding, not just for the community services, but of the participating provinces, but as well for the research and the other work that you're hearing about today. So on June 21st, Global ALS Awareness Day, thank you for joining us today. I'm very appreciative of your time and what you've brought to our conversation.